Hi there, this is Dr. Robert Ciprian from MuscleTestingDoctor.com and doing this quick little joint flow protocol for you guys for MuscleTestingTraining.com. So the first thing you do when you start to work on any joint in the body, the first thing you want to do is check the joint's alignment. Now, if the joint is misaligned, say for instance the shoulder, if the shoulder, the AC joint is separated, the muscle's not going to have a proper foundation, and then from there the cerebellum's not going to have the muscle functioning properly. So the first thing to do is to align any joint, make sure that everything is lined up. You know, if you're in the shoulder, say you're going to go from the SC joint, the AC joint, the scapula, to go to a humeral head, make sure everything's lined up, make sure all joint corrections are made. And of course, use your, you're a healthcare practitioner, chiropractor, naturopath, whatever. Use your education that you already have about adjusting the joints. Now, if the joint has an acute injury, some people are like, oh no, don't adjust it right away, and I really feel that you should get in there as soon as possible and work on an acute injury. I think you're going to decrease inflammation much faster. I think you have much faster healing time, and if you want to get the muscles worked on and get them functioning properly, you need to get that joint aligned. So for me, the first thing to do is to align that joint. Now, of course, take precautions, make sure there's no contraindications for adjusting that joint. Use your knowledge as a healthcare professional to make sure everything's okay before you go and adjust it. The second thing that you really want to take care of after you get the joint fixed up is the nerve innervation for the joint. Now, if we're working on the shoulder, you want to make sure that the innervation to the shoulder from the neck, the cervical spine, is flowing properly. If you're working on the hip, the knee, the foot, you want to make sure the lower spine is functioning properly. Whatever joint you're working on, you want to check the nerve innervation all the way up through the body. So if you're working on the wrist and checking that, well, you want to make sure the elbow is lined up to the shoulder, the neck. You want to make sure the whole circuit is clear and functioning properly. If you're trying to do work on a muscle or get a joint fixed up and you have a problem in the chain here of the nervous system, you're going to be doing a lot of extra work that's not going to turn out too well in the long run. So checking the nerve supply to any joint. Now, after you check the nerve supply, say you work on C4 in the neck, go and check the Lovett reactor from the bottom end up. So if you're doing C4 in the neck, you're going to go to L2 in the spine to make sure that's lined up properly too. And if you're doing something down in the lumbar spine for the lower extremity, make sure you check the Lovett up in the cervical spine too. Because if someone gets off your table and the Lovett is out of place, as soon as they start walking, the original joint that you just corrected can come right back out of place too. Then there's correlations with the spondylogenic reflexes too. So say you fix C4 in the neck, also check T4. That's very important too, to go and check T4. And then what you could do also, you can take an extra step and actually go to the Lovett of the spondylogenic. So say you just did T4, well then you would go down and hit T7, which would be the Lovett. Also, whenever you work on any muscle in the body, look to the rib heads that are actually related to that meridian. Alright, so if you're working on deltoid in the shoulder, say, make sure you go check out the T3, T4 rib heads, because if those are blocked there in the bladder meridian and the associated points, you're going to have muscle weakness. So you're trying to fix a muscle, but there's something out with the rib heads that could be causing it to be weak anyway. So it's another factor to take into consideration there. So the top things we have, number one, checking the joint alignment. Number two, checking the nerve supply and the Lovett and the spondylogenic. Number three, checking associated meridian rib heads to what muscles you're working on.